Hello, everyone. Yes, that's on. How are you on this fine Saturday? I don't stream on Saturday too often. I don't remember if I have before, but I always try to pick a weekend day. I'm excited to try, or not try, to play this new game. Or, well, new. We obviously played through New York, but try the Miami line. But before we get into that, I have to give a beanie update, which is that I got it. Oh, I'm so happy. Hi, Mom, you're tired? Me too. It was a very short night. Oh, I got my beanie. I'm so excited. Apparently, it was delivered to my neighbors. They were on holiday, and my number for my address looked a lot like the number for my neighbors. So I don't even blame the postal service person who wrongly delivered it or delivered it to the wrong house. But got my beanie. Whew. Hi, Eric. How are you? I guess you're also tired. We're all tired here, which I feel like works with the theme because we're going to be doctors today. We are playing Miami. That's not what we're playing. We're playing Medical Mysteries Miami Flatline. That's going to be mirrored for all I know. And we are playing patient number 1, which is of a medium difficulty. Let me first quickly explain how the game works. So it is a co-op, which means we all work together to try and solve the patient. Each of these boxes, so the medical mysteries, there's a New York, there's a Miami. They come with a tutorial patient, which will teach you the game without having to read the rules all in one go, which is nice. And it's the same tutorial patient for both. And then it comes with 4 patients. The New York one was the first one, like the first one that came out, and it has, I think, easy, medium, hard or something, whereas these are harder, where it starts with medium, then it has a hard case, and then the last 2 are expert. So we haven't tried expert yet. Hi, Dries. So I'm curious how that's gonna go, but I'm getting way ahead of myself because we were playing patient 1 today. Yeah, so it's a co-op game, which means everyone works together. You can play this with as many people as you want. I think this would solo pretty well as well. And every patient comes with an envelope with a little blurb, and at the back it'll tell you what is in the envelope. And it will be an intake interview. It'll be some electronical medical records. I'm gonna pull all of this up on the screen once we start playing. And then it's going to come with a bunch of story cards and a status card. And a little patient form that we are going to be filling out. Unlike the New York one, it is now in the middle of the day. We start our shift at noon, which I don't think will matter that much, but it's just a different time. And you have the patient intake interview that you start with. It's going to give you information about your patient, just like the electronic medical records. Your interview is going to prompt you to draw the first story card, and then you have some options and a status card. And then you're going to have some options available to you, which will be listed on the status card, which and you can take 3 actions in any time period, and then you're going to get an update on your patient based on how your patient is doing, which will change throughout the course of the game. And hopefully you get to solve what's going on and help them, and they walk out of there completely fine. Hopefully. Your patient can die, but that's not going to happen today, because we're going to work together to save this patient. Now, let's get started. Oh, wait. One important thing to note is you're going to do some actions, and they're going to give you a code. Thank you for the bits, Mom. On-screen celebration. You're going to get a code, which you're going to look up in this neat little booklet that comes with the game, and it's going to give you a little prompt. And it's going to tell you, usually it's going to give you some information, or it's going to tell you to take another story card, and then you're going to progress through the game. I think that's it in short. The game also comes with some information booklets that will give you some info on what certain tests do or what certain drugs do, what certain conditions are. And that's also going to help you or help guide you on what to do or what action to take next. All right. Obviously, again, a really big shout out to my husband, who very lovingly took photos of everything again and uploaded them into IBS, not IBS, OBS. Feels like IBS sometimes. Into OBS for me, so that I didn't get any spoilers and we can play this case and I can show you all the cards on the screen. It takes a lot of time, so thank you so much. Let me get over to the game. So yeah, obviously spoilers for this patient. I guess that goes without saying. Oh wait, let me post it on live. I almost forgot. All right. Okay. So the envelope says patient 1. After successfully completing the tutorial, your first patient, Zoey Williams, is brought in by her father. She seems to have something stuck in her nose. Classic. This is little Zoey. Classic situation. Have y'all ever had something stuck up your nose? I feel like I haven't, but my mom is in chat and she will correct me. Okay. Patient intake interview. Oh wait, let me bragging that we have this on screen and then not showing you. Zoey Williams, 4 years old, female. Not that you can recall, good. Zoey sits in her father's lap when you enter the examination room. Playing with a ribbon next to them is another girl, perhaps 7 in age. You introduce yourself. Zoey's father nods and says, "I'm Daniel Williams, Zoey's father." You squat to get down to Zoey's level. Zoey looks at you, then turns away, gripping her father's hand tightly. "Hi," says the other girl, stepping in close. "I'm Jasmine, Zoey's half-sister." "Give the doctor some space," says Daniel. Then to you, "Zoey has Don't tell," says Zoey, hiding her face. Daniel shrugs to you. "She's never been to the hospital before," says Daniel. "There's nothing to be scared of, honey. The doctor is here to help." Zoey squirms in his arms. "Hey, chillax," says Daniel. "You're going to be okay. Are you still tired? Did you two stay up late last night talking?" "No," say both girls together. "Well, you've been acting like you need an extra nap." You ask why they are in the emergency room. Daniel says, "She's got something up her nose." Zoey cries out as if she's been betrayed. "We were getting ready to take Jasmine to her father's house when Zoey came up to me crying with her fingers up her nose, saying, 'It hurts, it won't come out.' I tried looking up her nose with a flashlight." Wait, this is still in quotes, sorry. That's the back too. I tried looking up her nose with a flashlight. I can see something up there, but I couldn't tell what it is." Oh, that was Daniel. I thought that was Jasmine. Sorry. To Zoey, he says, "Will you tell the doctor what it is?" Zoey shakes her head. "I tried to get it out using tweezers like I saw on the internet, but she was moving around too much. So I decided to bring her here to see what you all could do." "I want Mom," says Zoey. "Mom's on a business trip, remember?" says Daniel. And she hasn't been home in a few days. If you know, you know. "She got on a plane this morning. She should be landing in Chicago later." Daniel burps suddenly. "Excuse me," he says. "My heartburn has been acting up something awful." You ask if Zoey has any other symptoms. "She's been really tired the last few days," says Daniel, "but that's got nothing to do with what's up her nose. You notice bruises on Zoey's forearms and shins, more than you would expect to see on even an active little kid." You ask if there's anything else he wants to tell you. "No," says Daniel. "Other than having something stuck up her nose, she is a perfectly healthy 4-year-old. And then it tells us to take story card 1. and take status card 1, object in nose. That's a funny status. I will pull those up for y'all, but first I'm gonna show y'all the electronic medical records. Let me see if I can move these. Yep. All right, so we've got Zoey Williams, who is 4 years old. She is about a meter high, 16.3 kilograms. Occupation, preschool. So her complaints are general fatigue. There's a foreign object in her nose, and she has bruises on her forearms and shins. No recent illness, no recent travel, none of that. No known drug allergies. Oh, her blood type is mentioned. Do y'all know your blood type? Because I don't. And doctors are like so shady about it. All her vitals are normal. Her immunizations are up to date, which is good. Family history. Father has high blood pressure. And she lives with her father and mother. She has a half-sister of the same mother. And she lives in home half of the time, attends preschool. You always forget to ask. I asked, and they were so shady about it, they just wouldn't tell me my blood type. I remember when I got surgery years ago, I tried to find out, and they were just like, nah. And I was like, she's got a special blood type. AB+, is that special? Mom, do you know my blood type? Okay, so general. She's alert, oriented, foreign object in her nose, bruises on forearms and shins. Vitals are normal. She's in a good mood. She's cooperative. Her respiratory is normal. No shortness of breath. So her extra... Oh, God, I forget to introduce this game every time as welcome to the Nissa pronounces medical conditions wrong game, because extraocular movements intact, eyes anisteric, no yellowing. Her right nostril is occluded with foreign object. Patent left nares. No cervical lymphadenopathy. So no swollen lymph nodes in the front of the neck. Strength is 5 out of 5 in all extremities. That's new. And cardiovascular, regular rate and rhythm, no murmur. Muscular, skeletal, normal muscle, no joint pain. No tenderness, bowel sounds in all 4 quadrants. No swelling, non-tender in the extremities. And gastrointestinal, no abdominal pain, vomiting, or diarrhea. Information obtained from father. All systems were normal except she has been napping after school, which is unusual. No recent cold symptoms, fever, diarrhea, or tummy ache. And again, in her last physical exam, her immunizations are up to date. Okay. Interesting. Yep. Status card. And story card. Status card 1. Gonna move this to the side. Status and story card 1. Whoa, that is large. Story card 1. Okay. So, her status is object in nose. Let me grab a pencil. We can interview her father. So the options we can take is we can interview her father, 1 action per 2 questions, or we can do some blood tests, or we can ask some specialists. We can treat immediately, but I don't know. I think we should ask some questions first, maybe. I always want to start with asking questions, talk to your patient. So, where should we start, team? The story card says, by the way, if we interview Daniel, her father, Zoey is shy and hides behind her father when you ask her a question. She even refuses to answer her father. I'll answer any questions you might have, Daniel says. All right, so you're saying ask, have there been any past incidents with objects in the nose? I feel like we would know. I think we could ask about, for what is Zoe's home situation like? Yeah, I think that's a good one. Maybe we should ask about Zoe being tired, or if she has any genetic disorders. I feel like if she had a genetic disorder, he would tell us. Like, that's, I think, something that you would disclose immediately as a parent. You wouldn't just wait for a doctor to ask. So, all right, let's start by asking questions. And let's ask 2 and 4. So let's start with 2. So for question 2, it gives us the code WSV, which I'm looking up. WSV. Take story card number 3. Do you mean evasive? You think he's being evasive about her nose? I don't know. I feel like maybe about the bruising, right? We'll see. So story card 3, and I will also, with question number 4, it's giving us JFJ. Which is giving us story card number 5. So let me pull up 3 and 5 for y'all. Wait, the codes. I have to write down the codes. I keep forgetting. WSV and JFJ. Story card 3 plus 5. All right, story card 3 says, so story card 3 was asking about, tell me more about Zoe being tired. Daniel says, now that I think about it, Zoe has been tired for a while. She's been taking naps sometimes after school. Is it something I should be worried about? Again, this kid seems to never stop moving, so I didn't think anything of it. I thought she was just wearing herself out. So she's been tired a lot. And then story card 5 is when we ask about her home situation. And he says, Zoe's home situation is great. Chandra travels quite a bit, but as I work from home 3 days a week as a programmer, someone's always at home with the kids when they're back from school. When Chandra's not traveling, she makes sure to give the kids plenty of one-on-one time. And we're doing something as a family nearly every weekend. Okay, so amazing home life. They're watching the kids, allegedly. But she is tired a lot. So let me look at some of these blood tests. Because if a child, is tired a lot, I'm immediately wondering, is there iron? But also, look, children can be pretty dumb. But maybe there's a reason she's sticking things up her nose, But bruising, bruising, I mean, you immediately jump to a worst case thing and, we think abuse. But if her iron is really low, she can bruise easily, or her white blood cells. So she might have some sort of deficiency. So I think that we should do a blood test. I say as I play a doctor on TV. Okay, so we've got... So blood test Anna is anti-nuclear antibody test for autoimmune disorders. CBC is a complete blood count test, uncovers conditions such as anemia, low red blood cell count, or maybe it's low red blood cell count, I think. Blood loss, infection, and leukemia. Oh God, I don't know leukemia. Chem7 measures 7 substances in blood: the urea, nitrogen, carbon dioxide, creatine, glucose, chloride, potassium, and sodium. Identifies kidney function issues, blood sugar levels, etc. And then a blood test DEB is a screening test for Fanconi anemia. A negative result means that the patient does not have Fanconi anemia. And then we've got a viral test, which I guess is just for colds and stuff, and COVID maybe. Viral test. Test that screens for viral conditions such as hepatitis B, hepatitis C, EBV, CMV, parvovirus, B19, and HIV. You think a Chem7? I'm thinking I was thinking a back. No, we can't do back. What am I saying? Blood alcohol. Is this child drunk? I'm thinking a CBC, so a complete blood count test. To be honest. Because a chem... I'm the doctor. Yeah. All right, let's do the CBC. Okay, so doing a CBC, it tells us to flip the card over. So I'm gonna write down CBC, and I'm gonna show y'all what it does. Available labs. Move that over. Since we're still in the very first column, because we are in the 12 to 2 p.m. shift, we get the code FKD. And it is telling us to take story card 18. Story card 18. Boom. Y'all see before I do. Zoey's tests come back with distressing results. Low red blood cells, low white blood cells, and low platelets. Okay. That's not good. Can I see anything about what? So let me get back to story card 1. It's no bueno, yeah. Wait, not the story card. No, I do want story card, but I also want the status. All right. So a pharmacist, I guess, would tell us about expert in medications. Yeah. Not much of a. I don't think we should call in a specialist yet. So we know maybe we should test the other thing then, because like all her blood cells are low. So maybe we should test. Either we do a Chem7 or the anemia one, Or, I mean, the ANA test, that tests for an autoimmune disorder, which I feel like could be what's going on. Let me see what this little booklet says about the blood. Blood type. Low RBC or white blood cells. Have the blood fight in. Usually low white blood cell counts increases the risk of getting an infection. Yeah, and a low blood test indicates like low red blood cells indicates anemia. So we should probably test for some sort of anemia. Yeah, exactly. All right. So we've got ANA, which is an anti-nuclear antibody test for autoimmune disorders, or we have the a specific type of anemia. Or the Chem7, which I guess we should test for the other, the specific type of anemia, right? Because as soon as you find out that all our... and we're going to get an update after that. She's still sitting there with that thing up her nose. We're like, let us run some tests first. Should we just take it out? What if she, like, snorts it further, you know? I know that I always, like, suggest to do things, like, put on cream, and then it's like, this does nothing. Procedures. Abdominal thrust. That's a workout? Oh, God. So an abdominal thrust is an emergency technique to clear the airway of someone who is conscious and choking. I feel like we're getting there. Don't want to do that. Don't want to have... well, I want to do it if I have to, but I don't want to have to do that. An ambu bag. A bag mask that forces air through the nose and mouth. I mean, that might get it out. CPR, obviously, that's a life-saving technique. Uh-oh. Distraction. A technique often used with children to divert attention from a disturbing or traumatic experience. So it's literally a distraction. I was like, oh, what could that mean? You're literally like clown's nose on. Suction and tweezers. So the dad tried tweezers. I know that he's not a doctor, but should we try tweezers? Use of tweezers to remove an object stuck inside nose. The dad said, she was moving around too much. Oh, okay, so he tried to do the tweezer thing, but she was moving around too much. So we have one more thing we can do before we get an update, and I feel like we should distract her, right? We should distract her and then try to get it out. But we can't do that back to back because we'll get an update in the meantime. And I'm worried if we try to distract her, she's gonna start. I'm worried that I know this is meta, but I'm worried that the next update is gonna be her getting it further up her nose. But maybe it's good to distract her anyway. So let's try to distract her. I'll say distract. Apparently that's going to take 40 minutes. FKZ. FKZ. Zoey hides behind her father. You pull a stuffed animal out of a drawer. Penguin with a Q just had something stuck up her nose too, you say. She thought it was scary. She could really use a hug. Zoe reaches out and hugs Penguin. May I try something else? You ask. Zoe nods. She has calmed down. Consider this action complete. Send in the clowns, Mom says. Yeah. The clowns are us. Okay. We're going to get an update. It prompts us to read the 1400 update, which is the code DEX according to the status card. So, the update says, as you consider your next step, Zoe laughs at something Jasmine says. It's a cute little snort of a laugh, but quickly evolves into a choking cough. Nurse Judy gently pats Zoe's back until she stops coughing and calms down. Do you still have that object in your nose? Says Nurse Judy. We should really get that out of there. Take story card 12. Yeah, I know we have to take that out of there. I was working on it when that stupid little sister made a stupid little joke. Okay. Story card 12. This dumbass child. I'm kidding. Daniel excuses himself. I need to call Jasmine's father and let him know what's happening. He dials. Oh right, she has the same mother, different father. He dials. Hey, Michael, it's going to be a while before I can drop Jasmine off. Zoe's in the emergency room. No, nothing serious like that. She put something up her nose. It looks like we're going to be here a while. I don't know. Okay. Thankfully, child didn't immediately choke and die. So, we can do another action. So we distracted her, and it is time to try to extract the thing. Should we use tweezers, an ambu bag, or suction? I feel like we should... That was the entire update. Yeah, just her laughing and him stepping out to call her or Jasmine's father. So I think we should start with tweezers, because you don't immediately start with the heaviest thing, right? You try the tweezers first, and we tried to distract her, so I feel like we have a choice. Or like we have a chance, tweezers. That is RZN. Take story card 17. Uh-oh. Why is her face that color? You ask Zoe to hold still as you insert the tweezers in her nose. Wide-eyed, she whimpers as you locate the object. Zoe struggles and the object slips from the tweezer's grip. This ends up pushing the object further in. Blood seeps out of her nose. As you prepare to try again, Zoe begins to choke. Emergency! Choose another procedure as a part of the same action. Oh, thank God. If the procedure does not result in emergency resolved, ignore the procedure and take story card 13 instead. We are killing this child! Oh no. No timers though, so we're chill. Alright, we had a thing that helped against, what's it called? Against choking. Oh, that's the abdominal thrust, right? That was the conscious and choking. Yeah, okay, so we have to do an abdominal thrust, which is the same. So that's YWQ. Oh no, don't die. If you are currently in an emergency, see result KAV. So the thing, Eric asked, the thing ain't in her nose anymore, but in her throat. Yeah, I guess. So we have to look at KAV because she's in an emergency. If Zoey is choking, oh my gosh, see result SFT. All right, that's a long redirect. SFT. The object must have gone down to Zoey's larynx. Eric, it's not in her throat, it's in her larynx. Please use a correct terminology. And blocked her breathing. Quickly, you start to give Zoey gentle abdominal thrusts. The short pulses of air force the object up and out of her mouth. Emergency resolved. Take story card 29. Okay, so we got an emergency resolved, which means that we're no longer in an emergency. 29. Easy peasy, exactly. 29. Oh! You clean off the object that was stuck in Zoey's nose to discover a pill. Take story card 26. Okay. Okay. That ain't great. With the object removed, Zoey's nose begins to bleed profusely. Nurse Judy says, this is abnormally heavy bleeding. Yeah, her blood cells are whack. Oop, no, what was that? Choose one of these 3 procedures to stop the nosebleed as part of the same action. We can have Zoey lay on her back and pinch her nose. We can have Zoey sit up, tilt her head back, and pinch her nose. Or we can pack the side of Zoey's nose that is bleeding with gauze. I mean, with a nosebleed, you have to pinch your nose, right? Lie down or sit up and tilt your head back? I feel like I always see people sit like this. Eric, you get nosebleeds. Tell me. My tea's gone cold. Because she is small, I would do lay on her back. Eric shoves something up his nose. It is abnormally heavy bleeding. The blood will go from her nose to her throat by looking back. That's true. It is heavily bleeding right now, yeah. Maybe gauze is a good thing, yeah. Alright. You've convinced me. Let's do gauze. So that is still the same action. QKX. QKX. Where is my booklet? Where did I put it? There. QKX. You pack the side of Zoey's nose that is bleeding with gauze. The blood pools in her nose. Before it can flow back into her trachea and choke her, the blood coagulates. You have stopped the nosebleed. Take status card 2, mysterious bleeding, and then take story card 15. Oh boy. 15, not 25. Alright, so we have a new status card. Let me pull that right up. And then 15. Oops, did something. You showed a pill to Zoey's dad, Daniel. He says, it could be mine. I'm not sure. I don't like having to pay I don't like having to pay attention to things like this, so I just set up all my pills for the week in a pill dispenser. Look, here's what I take. You ask what each pill is for. Oh, let me get the list for you. I thought he was like, I don't want to pay attention to my child. 23. Okay, we're gonna get a list of medications that we're gonna have to look up. I bet something is tied to her. Maybe that's why she has like all her counts are low, because something is blocking it. Oh, legally distinct iPhone. All right, so he is taking lisinopril, cimetidine, Lipitor, vitamin D, and Zyrtec. Man, drugs are fake. What are these? Nope. I'm changing something else. Okay. Well, time to look up some drugs. Yeah, she probably does think it's candy. Lisinopril. All right. Pay attention and remember these for me. Treats hypertension, which is high blood pressure. Side effects include low blood pressure, dizziness and headache, can increase blood potassium levels, particularly if the patient has kidney disease. Okay, so we didn't do the full blood work yet, so we don't know if she had, like, her other... We probably should, by the way. We probably should do that soon. The other thing, treats heartburn, stomach ulcers, and other conditions that cause too much stomach acid. Alright, he complained about that. Side effects include headache, diarrhea, dizziness, drowsiness, confusion, anxiety, hallucination, aplastic anemia, and depression. Okay, that feels like a contender. We've got Lipitor, which I think has to do with fats. Lowers cholesterol, yep. Vitamin D, is that even listed? Nutrient needed by the body to help with building bones. Fatty fish and fish liver oils are high in vitamin D. Low levels of vitamin D can lead to bone pain, muscle pain, fatigue, twitching, and weakness. But she wouldn't have low if she's taken his. Also, that did not look like a vitamin D pill. Zyrtec helps control allergies. All right. So maybe one of the first two. But actually, gang, I think that we should do a full test right now. So let's do... That was a Chem 7, if I remember correctly. Yeah. Chem 7, which makes us flip the card. None of them were the same color in the image. I don't know if that means anything. Yeah, you can just see the ones that he's taking, right? So, she had the image, the pill that she took was a green. Oh, as in the same color as this. I guess he takes his pill dispenser with him, yeah. That's weird. There's also an N on there and a 204. Anyway, okay, so let's flip over the thing. Status card available. So we are in the second column now, and we are doing a Chem 7, which is gonna give us BGH. BGH. Look that up. Results are normal. Okay. Results normal. All right. Then I guess, because I believe that was Yeah, Semitide. Oh no, Semitide had the side effects of a headache, diarrhea, dizziness, drowsiness, confusion, anxiety, hallucinations, aplastic anemia, and depression. The first one, litho, blah, 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 blah. Treat hypertension. Side effects include low blood pressure, dizziness, and headache. Can increase blood potassium levels. Can, so not always. So not always. Is that why we can ask a pharmacist? Because no, I dropped something. We can ask a hematologist. That's a blood specialist. Or we can ask a pharmacist who's an expert in medications. Maybe asking a pharmacist is a good idea. What do y'all think? Pharmacist? Alright. Alright, so a pharmacist. Yeah, like they would know. Pharmacist gives us UEE. If you have revealed a card with a pill symbol, which we did, that it's asking for this symbol up here. Take story card 25. Otherwise, they don't know. Okay, so story card 25. The pharmacist looks at the pill that came out of Zoe's nose. This is cimetidine for conditions that cause too much stomach acid, like heartburn, stomach ulcers, and reflux, she says. What was a little girl doing playing with these? This could be bad. Cimetidine has some pretty severe side effects, including aplastic anemia. The action is complete. If you would like to run a blood test to see if Zoe has cimetidine in her system, choose blood test cimetidine as your action and see result code RTT. I mean, we do, right? We do, but we can't because we're gonna have an update first. It is now 4 p.m. and we are gonna read a 4 p.m. update, which is gonna give us TNV. TNV. The entire family is starting to get restless. They clearly expected to be in and out faster than this. Daniel checks his phone and sighs. Your mother still hasn't landed yet, he tells Zoe. Oh god, are they gonna leave again? Alright, well, blood test, cimetidine. Cimetidine. RTT. Was that pill not the dad's? Doesn't mean she has the condition because it's not in her medication. No, but the side effects of the pill could affect her. No. That pill was in the list. It's the second one. You can't read it; it's mirrored. But he is taking that, so she got in his pill box. And it's dangerous to take certain medications. Like if something like lowers your blood pressure, for instance, and you don't have high blood pressure, that is a bad situation to be in. Okay, RTT. The blood test comes back positive. Zoey has definitely been ingesting simididine for some time. Some time? This is not just this once. Girl's been snorting that shit. Okay. Now what? Let's look at the drugs that we can give her to treat. Because we can do a blood transfusion. That's like a lot. Drugs. That's why she got muscle pain? Eric says, someone has to be giving it to her. There's no way a child thinks that a pill tastes good. We don't know. We can't ask her. Hey child, why are you snorting your dad's pills? So, azathiopyne, immunosuppressant used to calm and control the body's immune system. Chloroquine, first developed to treat malaria, now used to treat conditions such as HIV, lupus, and rheumatoid arthritis. She has to crush the pill first. Ibuprofen. Well, that's a... Let me see what it says, though. Non-steroidal anti-inflammatory drug, NSAID, used to relieve pain. Can worsen kidney function in someone with chronic kidney disease. And prednisone... slow overactive immune system to reduce inflammation. I don't really feel any of these pills at the moment for what she has. We can do some more tests on her. Something is clearly going on. Like, again, her... This could be unrelated. I don't know. We could still ask a specialist. We could still ask a hematologist. Yeah, you know what, Eric? Thinking the same thing. Let's do that. Hema. DHM. Take story card 11. Pull up the card. If you have revealed a card with a blood thingy, I believe we have. Yes, story card 18 has it. Take story card 32. Okay, so we're gonna ignore what it says at the bottom because we are gonna get story card 32. We're so good at this. Okie dokie. The hematologist says, look at these CBC test results. A nosebleed alone would not cause these numbers to be as low as they are. If anything, the nosebleed occurred because of her platelets are so low. To treat her immediate symptoms, give her a blood transfusion, but you'll also need to identify the cause. A bone marrow biopsy should shed some light on that. All right. I think we should give some drugs first, then. Or not drugs. We should give her a transfusion. Yeah. Thank you, expert. See, this is why you have experts, because we don't know. Let me first look at these procedures before I start doing stuff. Blood transfusion, medical treatment in which blood is transferred into a person's circulation intravenously. Transfusions are used for various medical conditions to replace lost components of blood. Of the blood. Yes. Then we've got biopsy, bone marrow, and a transplant. Biopsy is a procedure that removes sample of tissue, cells, or fluids for analysis. While imaging tests such as CT scans and MRIs are useful in detecting masses or irregular tissue, sometimes the only way to make an accurate diagnosis is to collect tissue for closer examination in the lab. Yeah, so we can bone marrow biopsy. Oh, and a transplant is why don't I see bone marrow? Oh, here. Bone marrow transplant, procedure to replace damaged bone marrow with healthy blood-forming stem cells that are infused into the bloodstream. Bone marrow donors must have stem cells that match the person receiving the donation. Siblings are much more likely to be matched than parents, but only about 30% of people needing a transplant have a compatibility-matched sibling. Yeah. Man, get your stem cells tested because people be needing it. Okay. I guess we should start with a transfusion. I think that takes a while, but that's where Jasmine comes in. Exactly, that's what I'm thinking. Or maybe your mom, because it's like, oh, your mom still hasn't landed, you know? Even though parents are less likely to be a match, they could be. But let's do a blood transfusion. Blood trans. RLU. Take story card 21. We're about to get another update as well. Oh, I need to drink some more. Yeah, that's cool again. Hold on, child, as I grab some tea. Oh, my glass is fogged up there. Alright, 21. Daniel asks if, as Zoe's father, he can volunteer to donate blood for Zoe's transfusion. I'm type O negative, so I'm a universal donor. You thank Daniel, but explain that it's not the best course of action right now. It takes time to collect a donation and test the blood, you say. Zoe needs a transfusion right now. You're welcome to add to the supply for others in need like Zoe. Oh, yeah. That makes sense. Take story card 27. Alright, well, we're going 27. You've already donated enough, sir. You donated your drugs. $27. You secure AB plus blood from the hospital's reserves. Zoe is very nervous when you show her the needle that you are going to put in her arm. Zoe's half-sister Jasmine takes her hand. You can be brave, she says. I'll be here with you. Zoe whimpers when you insert the first needle, but otherwise doesn't make a sound throughout the rest of the setup. The transfusion will take a while, so you leave Nurse Judy with Zoe as you make your rounds of your other patients. Take story card 28. There's a lot of chaining of actions that's happening right here. You check in on Zoe after her transfusion. She's sitting up in bed playing with her half-sister Jasmine, smiling and even giggling. Congratulations! Zoe will survive the night. Night? It is 6 p.m. However, Zoe's condition was serious. She could have died. She still might, as you have only addressed her symptoms. You still need to identify the underlying cause of her excessive bleeding. And what about that green pill? Take status card 3, smiling and giggling. Uh-oh, I'm worried they're gonna jet. I'm worried that his family is gonna disappear. Okay. We still have the same thingies. Do we have to take a... I'm a little confused for a second. Do we have to take the biopsy before we can do a transplant? Oh, wait, we're going to get an update first. HSZ. Take story card 6. We're getting a lot of these cards. Story card 6. Daniel sits with Zoey on his lap and Jasmine leaning on his side. Daniel says to the girls, "This is not how I thought I'd spend my wedding anniversary." Whoa, what? "Chandra's on a business trip and we're stuck at the hospital. I was going to take you out tonight to celebrate, Zoey." "And not me," demands Jasmine. "You're going to be home with your dad," says Daniel. "What are you getting Mom for her anniversary?" asks Zoey. "Well, they say you buy fruit or flowers for the 4th anniversary." Zoey and Jasmine laugh. "Fruit for an anniversary? That's hilarious." Daniel smiles. "Yeah, I think so too." What a cute family. Mom said bone marrow VFC, a biopsy, because that's what he suggested. Oh, was it? Let me see what he said. Oh yeah, we need to do a biopsy. Yes. Good remembering. Okay, so we are gonna do a bone marrow biopsy. And that is gonna be VFC. Take story card 9. 9. To perform the bone marrow biopsy, you need Zoey to lie on her stomach. This is good because now she won't be able to see the large biopsy needle you'll need to insert into her back to draw marrow from her pelvis. "Is this going to hurt?" Zoey asks. "Just a little bee sting," you say as you give her a local anesthetic. Zoey's half-sister Jasmine asks to be present to hold Zoey's hand while you perform the biopsy. That is a very brave half-sister because that shit is scary and it hurts a lot, which I guess is why they do an anesthetic. Oh, she asks to be present. Do we agree? Oh, yes, why not? Because it's scary? Is that child gonna freak out? Who are we to say no? But her doctors. What do you think, chat? What are we saying? It could be traumatic, the big needle. Yeah. At the same time, if we say no, maybe Zoey will freak out as we do it. But if her sister is holding her hand, she might be brave enough. She was squirmish before. Alright, well, then I will decide and say yes. We're gonna let her sit in. So that's story card 14. Zoe's half-sister Jasmine holds her hand. Jasmine's eyes widen as you pull out the huge needle. Zoe says, "What is it? What do you see?" Zoe turns around and sees the needle. She screams. It takes 20 minutes before Zoe's father can calm her down enough to proceed. You try to do good. Mark an X for your next action. You lose this action. Then proceed with the biopsy by taking card 16. Boo. That's the last time I say yes to a child. You send Jasmine out of the room with Nurse Judy. Zoe's father holds her hand. Oh, that was an option? Okay. While she whimpers, "You may feel a little pressure," you say as you insert the large needle. "Fortunately, any pain is brief and usually dull." "There," you say. "All done." Take story card 24. The lab returns its analysis of Zoe's bone marrow biopsy. The results are distressing. Zoe likely has aplastic anemia. Okay. So to reiterate, aplastic anemia is a potentially fatal disease where bone marrow does not produce enough blood cells. Causes include history of infectious diseases, history of taking certain medications, such as anticonvulsants or cimetidine, history of an autoimmune disease such as lupus, and inherited disorders such as Fanconi anemia. Symptoms include headache, dizziness, nausea, shortness of breath, bruising, fatigue, nosebleeds, fever. Diagnose with blood test CBC and confirm with bone marrow biopsy. Treat short-term symptoms with a blood transfusion. Next, restore body's ability to make blood cells with a bone marrow transplantation. Then identify and treat cause. All right, so do we know for sure? I don't know. I don't think we know for sure that it's not Fanconi anemia because I don't think we tested for that because it was so specific. There's a big chance that she has developed this because she's been taking her dad's pills, which is very sad. I bet the epilogue of the story is going to be like, hide your meds from your kids. Yeah, so we're doing a transplant, right? Because we already did a blood transfusion, so we're not doing that again. BM trans, which is MKG. Machine Kelly gun. If you have revealed a card with a bone, which we did, then see result DYM. Alright, we're going to DYM. Take story card 20. I feel like we've seen most of the cards by now. You bring in the hospital's transplant coordinator. They say, Zoe's bone marrow is failing to produce enough blood cells. We need to transplant healthy marrow from a matching donor. Rolling up his sleeve, Daniel says, "Tell me what I need to do." The transplant coordinator says, "Does Zoe have any siblings?" Daniel says, "There's Jasmine, her half-sister. She's from Chandra's first marriage." Take story card 30. The transplant coordinator says, the best donor would be a full sibling, someone with the same mother and father as Zoe. Since Zoe has no full siblings, it's unlikely any of you are a match. I've already searched the registry, and there's no matching donor for Zoe in the system. It can take months or longer to locate a match. There's a risk of complications as well that could lead to her death if we don't find a donor soon. I wish we had better news for you. This action is complete. Take story card 31. Oh, is the moral of this one, everyone get your stem cells registered? That's sad. I know, poor girl. A bone marrow transplant is clearly what Zoe needs, but without a donor, she's going to have to wait. You consider if you have addressed all of Zoe's symptoms and whether you understand the cause of them. You can keep working with Zoe until you're ready to complete your final report. However, you can't help but think there's something important you're missing. Take story card 7. I feel like we still need to test to see if she has the other type of anemia. Something's just not adding up. If you know what it is, write it down on Zoe's patient chart. Then read the result code relating to what you've written down. You may pick one. This does not require an action. Before filling in your final report, if you didn't find what is not adding up, take story card 34. The bruising was explained. They said that that's part of the anemia. I'm looking right now. Yeah, aplastic anemia is something that was caused by cimetide. So I'm not entirely sure. We could still try to do a dep to make. Although I'm not sure if we're allowed to. I think we have to do something now. I don't know. So this is where I'm like a little bit confused on what the game wants from us, because we know cimetidine could be a cause, so we didn't miss that. We have not checked for Fanconi anemia, which could still be a thing. Yeah, especially because this card says if you didn't find what is not adding up, take story card 34. And I'm like, is that the end? Or do we still get to do another action? It's also time for an update. I know. It's a little hard. I think it's hard too. Let's guess. I'm gonna guess Fanconi anemia. So I'm gonna look up Zeb. Since we didn't check it, I just feel that's like nagging in my brain. You ask Daniel about any genetic testing he and Chandra have done. He shows you, which we could have asked him about. He shows you a report from genetic testing performed when they found out she was pregnant with Zoey. Take story card 8 if you haven't already. We haven't. I'm not done. If you haven't already. Because Fanconi anemia is a recessive genetic disease. Zoe could have Fanconi anemia only if both her mother and father were carriers. This was not what wasn't adding up. Boo. Okay. Zoe's father says, when we found out Chandra was pregnant with Zoe, but we both had genetic testing done to see if there were any genetic conditions to be concerned about. I can pull up the results on my phone. Huntington's disease, mother's a carrier. Tay-Sachs disease, father carrier. So Fanconi anemia, the father is a carrier, but the mother is not. So that's not it. Boo. So we could have picked one of these. If you didn't find, take story card 34. Okay. I think we do have to do that before anything else. We're almost through this entire thing. As you are about to start filling out your final report, Daniel's phone rings. It's Zoe's mom, Chandra. You listen as Daniel shares with her the news because Zoe doesn't have a full sibling. They have to wait for a matching donor. Daniel listens for a while, then holds his phone out to you. Chandra wants to talk to you. Take story card 35. Okay. Alright, Chandra, what's up? She says, I've always feared this. I met Daniel the week after Michael and I separated. Oh, wait, sorry, I'm getting ahead of myself. She pauses, as if afraid to say these next words. It's entirely possible Daniel is not Zoe's father. And if he is not, then Michael is the father. You finish her thought, and Jasmine would be a full sibling of Zoe's. Drama! Take story card 36. We are now in Grey's Anatomy. It doesn't take long to confirm that Jasmine is a donor match for Zoe. Chandra talks to Daniel, then calls Michael to share the news with him and get his consent for Jasmine to donate bone marrow to her sister. I know, Maximi passed away from ALS. It's very sad. Jasmine looks confused and a little scared, but she agrees to help her sister. The bone marrow transplant is a go. It's time to fill out your final report. What was the cause of Zoe's symptoms? What treatments did she require? And what recommendations do you have for her and her family? Tree says cue random Damien Rice song. Yeah. All right, chat. What was the cause of her symptoms? I mean, she's been taking the man, all these names of these pills and these things. She's been taking cimetidine from her dad, and a long use of that caused her to have aplastic anemia, which destroyed all her blood cells and made her sick. A way to treat it was a bone marrow transplant. She says, I'm afraid to answer because I'm probably wrong. And then she's dead. No. She's fine. She survived. So we did a blood transfusion, or we tried to get the pill out that was stuck up her nose. Thank God that got stuck up her nose because she would have died. We took that out, and we had to do a blood transfusion because of her low blood count, and then we did the biopsy and the bone marrow transplant, or at least that's what we're gonna do. So that's a treatment that she required. What recommendations do you have for her and her family? Lock up your pills. Lock up your pills. Get some family therapy because there's some drama. And I think that's it. Did I miss anything? Daniel has to check more often. Check what more often? On what they're doing, yeah. Let me grab. Where is this? Oh, here. So when you're done with the case, after filling out the final report, you get an epilogue sheet that you can read, and then you can score. Sorry, I have to burp. And then you can score your case. No, this is small. I don't want this. Why is this suddenly so small? Okay, give me a second. All right. Zoey is not the first child to put something up her nose, nor will she be the last. Tweezers can push an object further up the nose to become a choking hazard. If you did this, you would need to apply abdominal thrust to dislodge the object before Zoey stops breathing. If Zoey stops breathing, CPR or an ambu bag would help her recover. You could attempt to use the ambu bag to force the object out of Zoey's nose. However, this is likely to frighten her. You would need to distract her to calm her down again. Suction removes the object from her nose without forcing it further up. So it was suction. Well done. You discover that the object is a green pill. However, Zoey's nose starts to bleed excessively. If you have Zoey lay on her back or tilt her head back, blood can flow back into her trachea. In addition to potentially causing her to choke, the experience will be traumatic. Packing her nostril with gauze allows the blood to coagulate and stop the nosebleed. Good job, Eric. Running a CBC blood test would reveal that Zoey's blood count is extremely low. Excessive bleeding combined with low blood count can be life-threatening. A blood transfusion helps Zoey restore her blood count to healthy levels and to assure she survives the night. But what caused the bleeding and her low blood count? To find the cause, you can perform a bone marrow biopsy. By the way, we might have had to have another update. Let me look what that was, actually, because it was 8 p.m. when we ended, because we did 3 actions. So let me look at LHW. Oh yeah, that just said, your shift is coming to an end. If you would like to continue your care for Zoey, you may take overtime actions. Otherwise, it's time to take your final report. Yeah. Okay, sorry. Bone marrow biopsy. The biopsy shows that Zoey has aplastic anemia, but what caused it? You could rule out a viral infection with a virus test, but Zoey doesn't show any signs of an infection. You can rule out Fanconi anemia either by running a blood test DEB or asking Daniel about genetic disorders. Fanconi anemia is a recessive genetic disease, so both parents would have to be carriers. You can rule out lupus with a blood test Anna, however lupus is rarely seen in children under 5. What about the green pill? Daniel says he takes 5 pills a day, but there are only 4 pills, none green, in each of his pill holder slots. Oh my god, I thought That's so funny, Eric. And you pointed it out that it didn't match. I thought it was just like a mistake or whatever, or like I thought, oh, this is just flavor. Or I thought maybe this was supposed to be blue and it's the blue pill in here because it's the same shape. But since none of them are green, that's also how we can tell she's been taking them. This game. All right. Daniel has been complaining about heartburn, which is what the cimetidine is supposed to address. So where are the other green pills? You could consult a pharmacist, which is what we did. She can identify the green pill as cimetidine and run a blood test, cimetidine, to confirm that Zoey has been eating the green pills long enough to have developed aplastic anemia. A bone marrow transplant is necessary to enable Zoey's body to make new blood cells. However, she needs a matching donor. The best donor is a full sibling, but Jasmine is Zoey's half-sister. At this point, you might have the feeling you're missing something important. And that something is that Daniel is blood type O-, story card 21, or O-. Reviewing the blood type chart, it's impossible. I was looking at that. Sorry that I'm cutting it off, but I was looking at that and I'm like, is this something I need to bother with? But reviewing the blood type chart, it's impossible for a child with AB plus blood, or AB positive blood, to have a father who is O-. A call from Zoey's mom, Chandra, confirms the possibility that Jasmine and Zoey are full sisters. It turns out Jasmine is a full match and a bone marrow transplant is a go. Oof. I guess that's another way we could have found out. So with the scoring, let's see. Oh, there's another story card. Plus 40 points if she survived, which she did. Plus 10 points if you cleared the object from her nose, which we did. Plus 15 points if you determined Zoey has aplastic anemia, we did. Minus 5 points if you gave her azathioprine, chlorine, ibuprofen, or prednisone to treat her for lupus. No, we didn't. Plus 10 points if you discovered cimetidine was the cause of her aplastic anemia. We did. Plus 5 points if you gave her a blood transfusion to restore her blood count. Yes. Plus 5 points if you consulted with a social worker. Even though they are likely caused by aplastic anemia, you should confirm that Zoey's bruises do not indicate physical abuse. We did not do that. Plus 5 points if you recommend Daniel prevent Zoey from accessing his pills in the future, which we did. Plus 5 points if you report Daniel for child neglect. Oh, this shit again. To your shift lead or child protective services. Specifically, he neglected to keep his pills away from his daughter, almost leading to her death. Neglect leading to endangerment is a must report for health professionals in Florida. See legal. Man, they got us with that last time, and I thought about. I was like, oh, I should look at that, and then I was like, I'll do it later. Yeah. All right, we will look at that with the next patient. Okay. So we didn't do that. Score if you have revealed a card with this symptom. 15 points for figuring out Daniel could not be Zoey's birth father. No. Minus 5 points for pushing the pill back and causing her to choke. Okay. Minus 5 points for not addressing choking immediately, leading Zoey to stop breathing. Absolutely not. Minus 5 points for not applying CPR when Zoey stopped breathing. We didn't do we didn't do CPR. But we did the ambu bag. But I guess that was enough because we did not reveal a card with the heart symbol. I thought we might have. That's why I'm checking. This is way more extensive, by the way. No, we didn't. Okay. Minus 5 points for tilting Zoey's head so the blood in her nose ran down her throat, which is what I would have done. So thank you all for correcting me on that. and minus 10 points for leaving the object in Zoe's nose for 4 hours. We did not do that. No, we took it out. Alright. Let me do some maths. And by me, I mean the calculator. I got 80 points. 80. I think that's pretty good. Take story card 38. So the last one. Zoe has a speedy recovery and has a huge smile on her face, thanks to her sister's bone marrow donation. It's all still a shock to me, says Daniel. I can't believe my little girl almost died because I was careless. He hugs Zoe and Jasmine. No matter what the future holds for our family, you will always be my little girls, both of you. That is a sweet ending. Here's the thing, even though we legally had to report him to our superior or Child Protective Services, I would be a little scared reporting a black man. I'd be way too scared that they would, like, it's not our business, but he clearly loves her. And he does need to pay better attention. Obviously, it's very dangerous what happened. But I don't want to be responsible for their family being torn up. Oh, thanks for the bits. Success. Thank you, Eric. I heard some sort of sound. Oops. We did it, team. She survived. And furthermore, she thrived. See, we only had these cards left. That's not a lot. My mom wants to know how you do that. I keep looking how to give bits. Aw. I don't know, Mom. I can look into that for you. So I looked through the cards and actually, spoiler, but none of these say that she dies. Oh! Thank you. A hype train. Oh my god, this is the first hype train. What do I do? Hype, hype, hype. I've never had this happen. Hype train because we saved this little girl. It says something about there's a limited amount of time to get like certain emotes or something. I have to look into getting, because I can now get or upload custom emotes that y'all can use, which is cute, and I love that. I just really need to think on what I want and what we should do. If you have any like suggestions, please let me know. You know, I'm always thinking about my cats. Just in general, but also as like a thing, but I don't know. Cat, yeah, exactly. Absolutely cat. That was a fun case. I like that it tries to teach you things with every case as well. Cats are good. Yeah, I need to see someone who can make emojis for me. Trace, what in the heck is that? Is that an onion? Stinky cheese. Cheese is also good. Oh, love cheese. Yeah. Thank you for saving that little girl with me. That was a shorter one, I think, because it's a medium. I think they're supposed to last between 1 and 2 hours, I think. I don't know when I'm gonna continue this. I will at some point. The next one that we are gonna do is gonna be a hard one. So I'm curious. However, We need to keep the abuse in our minds for next time. That's a very funny sentence out of context. Yeah, I mean, that's what I thought of, but I don't want to accuse people immediately. I don't know if we have any more children in this, and honestly. So because next week I will be streaming on Wednesday and Sunday. On Wednesday, I will be streaming Cozy Stickerville, which I'm very excited about. So that's a board game, an actual physical board game that everyone and their mom is talking about and posting about. And it just looked so cozy and exactly what I needed. So I wanted to stream it. I bought some things and I set up a rig to showcase my desk, to like show my desk and what's on it. I probably need some extra lights, but that's a future thing. I think it should work well enough, at least for Cozy Stickerville. So I'm going to be trying that. It's going to be the first day. And we'll see if I want to continue that on stream as well, or if I just want to continue that alone. But I'll be doing that on Wednesday, the 25th, at 7 a.m. PST, or 10 a.m. EST, or 4 p.m. UTC +1, which is Amsterdam time. So it's going to be in the afternoon for me. And then on Sunday, I'm finally continuing Star Wars Outlaws. I really want to play. My last stream was cut short because of technical difficulties. I'm probably gonna lower some stuff to hopefully be able to play a little longer on Sunday. But yeah, I'll be playing at 10 a.m. PST or 1 p.m. EST or 7 p.m. UTC +1. Again, that is Amsterdam time, so that's going to be in the evening for me. And we'll continue Star Wars Outlaws. As always, posted on Blue Sky. And then it's already March, y'all. Time is flying. So yeah, thanks for joining me. Hopefully see y'all when I play Cozy Stickerville as well. I'm very curious what that turns out to be. I actually don't really know much about it, except that I just felt the cozy vibes and I was like, I need this. So we'll see how that works out. So yeah, thank you for joining. Thanks for the bits. Thanks for the hype train. That is going on the books as my very first hype train. So that's a cute one. All right. Well, thanks for joining and have a nice day, evening, night, but definitely life. Bye, y'all.